Infertility is one of the most painful things that your parishioners are going to deal with, and it's common. It's estimated that 1 out of 6 couples is going to experience infertility in their lifetime. So many times they're going to come to you seeking advice about what's okay, what's not okay, what does the church teach? And I know from having spoken to priests that that question can be extremely intimidating because priests often feel like they have to be the bad guy. Like all they have to offer the couple is a list of no's. But the reality is, by teaching the couple about what the church actually says, you are giving them a whole list of yeses that are actually better for them, for the woman with respect to her health, and for the couple in their relationship. Realize that for most of these couples, they've come from the fertility doctor's office and been told something along the lines of, you have to do IVF, it's your only hope. For these couples, realizing that they may not be able to have children is creating a sense of panic in them, and the doctor's words and the doctor's suggestions are heightening that sense of panic. And so the first and most important thing to say to the couple is, I'm really sorry for everything that you're going through, and I'm really sorry for everything that you're suffering, but there is hope. There are alternatives to IVF. There are other doctors who have treatments that are as effective, that are completely in line with Catholic teaching. It can be really helpful to understand the couple's statements and behavior and reactions in terms of the stages of grief: guilt, anger, bargaining, sadness, denial, eventually acceptance. With infertility, it's important to realize that unlike other types of grief where something really sad happens, there's a terrible pain, the person goes through all of those stages, and then with time, the grief passes. With infertility, every new month that a couple doesn't conceive is a new and terrible grief. One of the most common expressions of the grief of infertility is actually anger. And that anger can take many different forms and be directed in many different places. It can be directed towards the spouse, can be directed towards the sister who can get pregnant easily. It can even be directed towards you as the priest or the church. And so many times when couples seem militant and angry that they can't do IVF or the church is telling them what to do, it's really just an expression of this anger that is a reflection of their grief. The way that you can be most helpful to a couple that is in that stage of bargaining and rationalizing is to be very clear about the church's teaching and to share that with compassion. The Catholic Church's teaching with respect to acceptable treatments for infertility is really clear and goes all the way back to a fundamental teaching in the document Humanae Vitae. God willed that the act of loving intercourse between a husband and wife serve 2 purposes. One we call unitive, the unifying of the husband and wife, and the other procreative, the bringing forth of new human life. And so when it comes to infertility treatments which preserve that connection are okay, they're licit. Treatments which separate them are not, or treatments that introduce a third party into that process are not acceptable. Now, that's a lot of technical terms, and usually, if you say it, the couple's eyes will glaze over. What I typically tell couples who ask me this question is, the church's teaching might be hard to understand, but we believe that it was for a purpose that God Himself willed that every new human life would come into being in the womb of a woman through this intimate act between a husband and wife. And that separating those 2 things, the intimate act and the creation of new human life, will have very serious consequences, not just for health, but for the relationship, for the family, for the child. So in vitro fertilization, the conception of the child occurs completely separate from the husband and wife. In fact, no active intercourse is even necessary. The eggs are harvested from the woman, the sperm are given by an act of masturbation, they're put together in a dish and reimplanted in the womb in a surgical procedure. And so in vitro separates the procreative from the unitive. When making a judgment, anything that separates intercourse from creation of the baby, not okay. Anything that works to normalize health and function in the woman's body or the man's body to make that loving act of intercourse fruitful and bringing forth new human life is okay. The truth is that some couples will not conceive no matter what we do. If a woman has 2 blocked tubes that can't be repaired, if there are no sperm, or if a woman is just past the age where natural conception is possible, that couple won't be able to conceive through naprotechnology. And in that case, the best thing that you can do is support them in their grief. It can be really helpful to say to them, I'm really sorry that this happened to you. This is a real loss. Just like the loss of a child or the loss of a spouse, it's a true loss that you truly have to grieve. But with time, you will find healing and that grief begins to pass. It can also help to just ask them, have you ever considered adoption? One of the things that we see as couples go through this naprotechnology process is that the process itself actually helps them to reach a point of closure. They understand why they couldn't conceive. They feel like they gave it a fair shot. And over the course of it, they've usually started having discussions about whether adoption is an option for expanding their family. And honestly, some of our most beautiful success stories are in families that adopted, and looking back, almost invariably say, now that this child is part of our family, we understand why we went through this. With couples coming to you, I think the most useful thing is to try to find out what they know and what they understand and start there. Start with addressing any misconceptions they have, and always with compassion. So understanding the deep need, compassion for the suffering, but clarity that this is what the church teaches and this is what we would recommend against, and this is what we would recommend for. Naprotechnology stands for Natural Procreative Technology and has as its primary focus working cooperatively with the natural menstrual cycle. With naprotechnology, we have alternatives that are as effective, if not more effective than IVF, that are completely consistent with Catholic medical ethics, and that allow a couple to conceive through natural intercourse, which, believe me, every couple would prefer to conceive through a loving act of intercourse with their spouse than through this invasive and painful procedure. And in all of this, no matter how the counseling session begins or progresses, always end with a positive. This is great news. We have a great alternative to IVF that's more successful, that's better for them, that's better for their marriage. And so sympathize and end with hope. When they come to me as a doctor, they want to know medically what's possible, but I am not the moral authority. A couple that's sitting in your office is there because they recognize you as the moral authority that's going to teach them about what is important to them, their Catholic faith. And so I can only encourage you to not be intimidated, be willing to be educated, and be willing to educate the couple. Because in many cases, you're going to be their only stop after the IVF clinic before they make a decision. So it's a great opportunity to let them know exactly what the church teaches and that there are alternatives available. We're facing a lot of challenges in healthcare, especially in women's reproductive healthcare, but there need to be voices that bear witness to the truth, that human life is sacred from the moment of conception, and that testify to the dignity of the human person and the importance of the marital bond. Couples need to get that message in your office, and it needs to be reaffirmed in my office. And above all, we need to give couples the positive alternatives that are going to allow them to live that out.